The DIEP flap is a surgical procedure that we specialize in here at Park Meadows Cosmetic Surgery. It is utilizing the tummy tuck tissue, really the abdominal fat and skin, in order to use that for breast reconstruction. In traditional techniques, the abdominal musculature is taken along with the abdominal fat and skin to help protect blood supply. However, since 1992, plastic surgeons have known that we can actually separate out the blood supply, or the pipes, if you will, from the abdominal musculature. It's been shown now in several studies that the more abdominal musculature you can save, the more stable and the better functioning the abdominal donor site. I like to tell my patients that if you're going to borrow from Peter to pay Paulette's, if you're going to borrow from the abdomen to reconstruct the breasts, any donor site is going to have a price. That price could be abdominal weakness, that price could be abdominal bulging, pain, discomfort, and the goal with muscle-sparing techniques such as the DIEP flap is to limit donor site payment or limit donor site morbidity, i.e. save the muscle and you save more of the function. The only way not to have a donor site problem is not to use a donor site. And again, these techniques focus on reducing any risk postoperatively for discomfort or lack of function in the abdomen. The DIEP flap is a microvascular technique in which removes the tissue from the tummy, and then you have to go and plug that tissue back in the chest. This involves microsurgery. Very few people in the United States do that compared to implants. It's something that we enjoy doing, something we do very well. However, it does involve plumbing, hooking those blood vessels back up. And so this is an extra amount of skill, extra amount of technique that we perform in order to salvage that muscle. Once the DIEP flap has been harvested from the patient in the operating room, then we do move it up to the chest. It's similar to transplanting tissue from one area to another. Most of our patients here are bilateral, but certainly unilateral reconstructions are frequent as well. And so that means we can reconstruct one or both breasts with that tissue. We then reconnect the plumbing. Those are the pipes, the blood vessels that bring in the blood to the tissue. Without that, the tissue does not survive. So you are committed to doing that extra work. Once the patient heals, they leave the hospital in 2 to 3 days, and then we start the next stage of the reconstruction, which is secondary shaping, nipple reconstruction, symmetry adjustments, etc.